Today we're here for a meeting on how to invest in contraception for adolescents, really, mostly, and how to bring them up to speed about what's happening, about their sexual health, and how us as partners and stakeholders can play a role in promoting safer sex and safer pregnancies in children.
The data that has been presented shows that Uganda, again, is one of those youngest countries in the world. 70% of the population is below the age of 24. And yet, we see that 1 in every 4 girls is actually pregnant at one time, or having her second pregnancy, or even having an abortion. This spells bad for the development which we want to see.
It's easy and cheap to stop pregnancy. I could have continued with my education. The 600 girls could have lived.
If all what you're saying is right, then I don't want to see my child die. I don't want to see 600 girls dying too. I don't want either of you raising babies when you're not ready. If we can do anything, please, let's do it now.
The effects are really very, very bad in that young girls lose their lives, like it was shown. And then there's also wastage in terms of the treatment of the complications that arise out of this. So it's something that should be taken seriously by all stakeholders and not only government.
If we are going to address adolescent health, we need to work with the parents themselves, with the young people themselves who have been in this forum, to see how their participation can make a difference and stop the current carnage, the destruction that is occurring because of non-use of contraceptives, but also a breakdown somehow in the society, its norms and values.
It's always interesting to come to another country and see the challenges that, our fellow brothers on the continent are facing. And, some of the solutions and recommendations, that they're coming up with to deal with these challenges. Information and knowledge is a powerful thing. And when you're able to learn something from, your friends and see how it's working with them, you're able to translate that and, take it to your own situation and try and see how it can work for you.
Dr. Olive strictly brought something home that I've been trying to understand for some good time now, the involvement of men in ways to empower the women as well. You can't talk about a girl and not talk about a boy. You can talk about a man and not talk about a woman as well. So involving the men in the issues that concern the women as well.
I see a picture of new hope being given to the initially lost hope. The hope that tradition had already judged to be misplaced. Hope that systems of culture and religion has rebuked, okay? I see some hope coming in and say, fine, before getting to the extent of being condemned as an ended journey, you can prevent that from happening through contraceptives.
We need to take on the mantle and spearhead the campaign to see to it that government meets its commitments of increasing financing to, 1, family planning, but also to maternal and the newborn children and also the infants.
I'd love to see more of this, especially as a region, in East Africa and Southern Africa, to see more organizations coming together, pooling their resources, pooling the ideas that they have. So I'm grateful for that experience.